Understanding your
frequently
diagnosis
experience
is the
a
first step
distressing
toward
sensation
recovery.
of numbness,
We'll monitor
pins
this
and needles,
closely and
burning
adjust the treatment
tightness,
plan as
or
needed.
ice-cold deadness in your legs and feet, pay close attention. Clinical neuroorthopedic data reveals that persistent lower extremity tingling is rarely just a local foot problem, but rather a warning sign of neural entrapment and microvascular hypoxia. Deep inside your lower back, compressed intervertebral discs at the L4, L5, and S1 spinal segments frequently pinch the roots of your sciatic nerve, choking off essential axonal blood supply. Simultaneously, micro-capillaries supplying blood to your peripheral nerves suffer from endothelial constriction, starving fragile myelin sheaths of oxygen and essential metabolic glucose. Most
Pain
aging
occurs
adults
when there is
attempt to
pressure
soothe this
on this
discomfort
specific
using
area of the
temporary
nerve
topical
root,
creams,
often
warm
causing
foot baths,
discomfort
or
down the leg.
nerve-numbing medications that merely mask signals without unpinching the nerve. In orthopedic surgery, we recognize that nerves are dynamic, fluid-filled biological cables that require continuous gliding movement and oxygenated blood flow to survive and transmit signals. When prolonged sitting or lumbar compression glues your sciatic nerve to surrounding anatomical
We can
fascia,
start with some gentle,
nerve signals become
non-pharmaceutical
distorted,
options. I suggest
generating phantom
incorporating
burning,
light stretching and
tingling,
these simple
and
movements
numbness
into your
down
daily
your
routine.
legs. This chronic nerve entrapment weakens your ankle motor control, blunts spatial floor sensation, and significantly increases your risk of catastrophic balance loss and sudden tripping falls. The encouraging medical truth is that you do not need invasive spinal injections, risky surgeries, or heavy pharmaceutical prescriptions to release pinched leg nerves and restore sensation. Neurobiomechanics proves that a specialized, surgeon-backed movement known as Sciatic Neural Gliding or nerve flossing can immediately free trapped peripheral nerves right from your chair. By performing this simple, targeted nerve gliding exercise daily, you physically slide the sciatic nerve back and forth through its neural sheath, breaking up fibrous adhesions. This gentle sliding movement acts like a biological pump, driving fresh oxygenated blood into ischemic nerve bundles while releasing mechanical pressure along your entire lower limb. Instead of stretching tight nerves violently, which causes protective muscle spasms and worsened nerve inflammation, this protocol utilizes joint-safe, rhythmic neural glides to soothe nerve tissue
lumbar
safely.
region is often
Within
where patients
minutes of
experience the
activating
most
this clinical
discomfort.
neural gliding
But the
movement,
good news is,
nerve sheath pressure drops, localized tingling subsides, a warm surge of circulation floods your toes, and normal feeling returns. You do not have to live with perpetual foot numbness, fear sudden leg weakness, or feel disconnected from the ground beneath your feet as the years advance. Your peripheral nervous system retains an extraordinary lifelong capacity to repair damaged myelin sheaths, restore axonal transport, and clear tingling sensations when provided with correct movement cues. In this comprehensive neurological restoration guide, Dr. Robbert will decode the exact medical mechanisms behind nerve entrapment and walk you through every step of this miracle exercise. You will learn how to set up your posture, control foot dorsiflexion angles, and execute precise neural glides that safely unlock trapped nerves from your spine to your toes. This simple exercise takes under 5 minutes each morning, requires zero special equipment, and can be performed easily regardless of your current mobility level or age. By committing just a few peaceful minutes each day to this clinical neural protocol, you can eliminate burning tingling, reactivate dormant sensory nerves, and walk with vibrant confidence. Before we demonstrate the foundational steps of this neural gliding exercise together, let us perform a detailed medical investigation into how nerve roots become trapped and starved of blood. Let us examine how gravitational load crushes spinal nerve roots, how fascial adhesions bind sciatic fibers, and how micro-capillary constriction starves myelin sheaths. Grasping these neurological realities empowers you to take complete, educated control over your body, shielding your peripheral nerves and spine from accelerated decay. Sit back comfortably in your chair, take a slow, deep breath, and prepare to discover the transformative neural exercise blueprint that will free your legs from numbness. In the next section,
Now, to
we
begin the
will
exercise,
analyze
I
the
want you to sit
cellular
up straight,
structure of
just like
peripheral
this,
nerve
and
sheaths
gently
and
rotate your
introduce the
shoulders
exact
backward
setup
5
mechanics
times.
for our gold standard neural
The
gliding
issue seems to be
exercise.
originating
We will
right here in the
demonstrate how
lumbar
targeted
region,
head tilt,
affecting the
paired with
sciatic
gentle foot
nerve as
pumping
it
pulls,
extends down.
trapped nerve roots through spinal foramina without placing a single pound of compressive shock on your back. Together, we will replace temporary Band-Aid remedies with surgeon-backed neurological restoration protocols designed to keep your legs sensation-rich, steady, and completely pain-free. No matter how many years you have struggled with numb feet or tingling legs, your body retains the innate biological capacity to heal when given the right stimulus. Let us begin this empowering journey toward total neural revitalization and lifelong physical
For the head
sensory
back and
freedom
foot flex
right
slide
now.
phase,
To
extend the
perform this
affected
gold
leg and
standard
dorsiflex
neural
the foot.
gliding exercise
Then
safely,
gently extend the
sit
neck
upright
backward.
on the front edge of a sturdy wooden chair, keeping your spine decompressed and your feet flat on the floor. Plant your hands lightly on the sides of your chair seat or on your thighs to lock your upper torso in neutral alignment, preventing any backward slouching or lower back rounding. Begin by slowly extending your affected leg straight out in front of you until your knee reaches horizontal alignment, keeping your heel hovering slightly off the ground. Now, understand the exact biomechanical tension rule. Never flex your neck down while pulling your toes back simultaneously, as this stretches the nerve aggressively from both ends and triggers protective muscle spasms. Instead, we utilize the clinical slide and glide principle. As you tilt your head gently backward to look toward the ceiling, flex your foot back toward your shin in deep dorsiflexion. This simultaneous head tilt and foot flexion draws the sciatic nerve downward toward your foot while releasing tension at your spinal cord, allowing the nerve cable to slide smoothly through its sheath. Next, as you lower your chin smoothly toward your chest in gentle cervical flexion, point your toes forward and down in plantar flexion away from your shin. This reverse motion pulls the sciatic nerve upward toward your brainstem while releasing tension at your ankle, sliding the nerve cable in the opposite direction without stretching it taut. Repeat this smooth, rhythmic alternating glide for 10 controlled repetitions, matching each forward and backward glide with deep, calm diaphragmatic exhalation. Feel a gentle, warming release sensation traveling from your lower back, through your hamstring and calf, and directly into the arch of your foot and toes. Pause for a deep breath, reset your posture, and execute the exact same 10-rep neural gliding sequence with your opposite leg to maintain symmetrical spinal balance. This specialized neural flossing movement physically unglues fibrous adhesions, increases intraneural blood flow, and restores the natural gliding mobility of your sciatic nerve trunk. Unlike aggressive hamstring stretching that irritates inflamed nerve fibers, this fluid sliding motion flushes metabolic waste and hydrates starved nerve myelin sheaths. Immediate clinical results include a noticeable reduction in localized foot numbness, a warming surge of arterial blood in your toes, and sharp restoration of ground sensitivity. For maximum neurological benefit, perform 2 sets of 10 glides per leg every single morning immediately after waking up, when nerve tissues are most dehydrated from overnight rest. By mastering this precise neural flossing technique, you take direct control over your sciatic nerve mechanics, freeing your lower limbs from chronic tingling and burning sensations. Let us now prepare to explore the secondary micro-pumping phase of this exercise, engineered to activate peripheral foot mechanoreceptors and restore sharp spatial balance. In the next section, we will analyze how pairing neural glides with intrinsic foot contractions awakens dormant nerve endings in the soles of your feet. We will also demonstrate how properly hydrated myelin sheaths accelerate electrical nerve signal conduction velocity, eliminating leg heaviness and wobbly steps. Eliminating neural entrapment through controlled nerve gliding provides your peripheral nervous system with the exact mechanical environment needed to heal and resensitize. By committing to this surgeon-backed daily routine, you protect your spinal nerves, prevent age-related sensory loss, and preserve your complete physical freedom. Together, we will continue replacing temporary pain remedies with clinical movement protocols designed to keep your legs sensation-rich, steady, and completely pain-free. No matter how many years you have suffered from numb feet or leg tingling, your peripheral nerves retain the biological capacity to regenerate and transmit clean signals. Let us advance to the next phase of our neurological restoration protocol and unlock the micro-activation interval together right now. After releasing the primary sciatic nerve trunk through neural flossing, we must activate the peripheral nerve branches that feed your lower calf, ankle, and foot soles. Below your knee, the sciatic nerve splits into two major clinical branches: the tibial nerve running down your inner calf and sole, and the peroneal nerve wrapping around your outer shin and top of foot. When prolonged sitting or swelling compresses these distal nerve branches, sensory signals from foot mechanoreceptors become completely blocked, causing your feet to feel ice-cold, wooden, and unresponsive. To perform Phase 2 microactivation, remain seated upright on your chair, extend your right leg slightly forward, and execute 10 controlled toe curling and toe spreading cycles while maintaining your head tilt rhythm. As you tilt your head gently backward, flex your ankle toward your shin, and curl your toes tightly inward, compressing the tibial nerve plexus along your foot arch. As you lower your chin toward your chest, point your foot forward, and spread all 5 toes wide apart, stretching the superficial peroneal nerve across the top of your foot. This alternating toe curl and spreading motion acts like a localized micropiston, driving warm, oxygenated arterial blood directly into the small micro-capillaries nourishing peripheral nerve endings. Feel an immediate, deep warming sensation spreading through your midfoot arch and into the tips of your toes as oxygenated blood restores nutrient delivery to starved nerve fibers. Pause for a gentle breath, reset your posture, and execute the exact same 10-cycle microactivation sequence with your left leg to ensure balanced peripheral circulation. This dual-action neural pumping routine accelerates the clearing of metabolic waste, reduces intraneural fluid pressure, and wakes up dormant Meissner and Pacinian corpuscle touch receptors in your skin. With sensory touch receptors fully reactivated, your brain receives instant, crystal-clear feedback regarding floor texture, weight distribution, and step stability with every step you take. By combining primary sciatic nerve flossing with secondary peripheral toe pumping, you establish a complete biological circuit that shields your entire lower extremity from progressive sensory loss. Let us now prepare to analyze the 5 dangerous daily mistakes that quietly crush your leg nerves and cause burning, tingling, and numbness to return after age 60. Many well-meaning seniors inadvertently pinch their sciatic nerve roots through improper sitting postures, tight clothing, unsupportive footwear, or prolonged immobility throughout the afternoon. Identifying and eliminating these 5 silent nerve hazards guarantees that every minute you invest in your neural gliding routine delivers permanent, long-lasting sensory recovery. In the next section, Dr. Robbert will break down these 5 critical lifestyle errors in detail and provide simple, surgeon-backed daily corrections for each one. We will also integrate these clinical safeguards with our neural exercise into an easy-to-follow 30-day action blueprint for your daily morning and evening schedule. Together, we will continue replacing temporary nerve-numbing remedies with clinical physical restoration protocols designed to keep your legs feeling vibrant, warm, and completely pain-free. No matter how many years you have struggled with numb feet or tingling legs, your peripheral nervous system retains the biological capacity to heal when guided correctly. Let us advance to the next phase of our neurological restoration protocol and explore the critical nerve safety rules together right now. The first critical error that quietly crushes your lower spinal nerve roots is sinking into deeply cushioned, overly soft sofas that collapse your pelvis into a backward tilt. When your pelvis tilts backward on a soft couch, your lumbar spine flattens and flexes forward, dramatically increasing internal hydrostatic pressure inside your L4-L5 and L5-S1 intervertebral discs. This continuous posterior disc pressure forces disc gel outward, directly pinching spinal nerve roots and triggering intense burning sensations down your sciatic nerve. Always sit on a sturdy, flat-seated chair that supports an upright spine, maintaining a small lumbar support pillow behind your lower back to preserve your natural inward spinal curve. The second major mistake is habitually crossing your legs at the knees or ankles while sitting for prolonged periods throughout the day. Crossing your legs places direct mechanical pressure on the fibular head just below your knee, crushing the superficial peroneal nerve against bone. This focal nerve compression cuts off blood supply to nerve fibers, causing your outer calf and top of foot to go completely numb within minutes. Maintain both feet flat on the floor with your knees uncrossed, keeping your hips and knees aligned to ensure open, unobstructed neural pathways. The third critical error is wearing tight elastic socks or restrictive waistbands that create a physical tourniquet around your limbs. Tight elastic bands restrict superficial micro-capillaries, supplying blood to cutaneous nerve endings, starving peripheral myelin sheaths of essential metabolic oxygen. Choose loose-fitting, non-binding diabetic socks and comfortable clothing that allow unrestricted capillary blood flow to your lower extremity nerves. The fourth major mistake is soaking your numb feet in scalding hot water under the false belief that extreme heat will wake up dead nerves. Because peripheral neuropathy blunts heat-temperature skin receptors, scalding water can cause severe thermal skin burns without you feeling any initial pain. Always test water temperature using your wrist or forearm before soaking your feet, ensuring water remains comfortably warm rather than dangerously hot. The fifth critical error is executing rapid, sudden spinal twisting or aggressive forward bending movements to crack or pop your lower back. Sudden, uncontrolled lumbar rotation subjects thinning disc fibrous rings to destructive shearing vectors, risking acute disc herniation and severe nerve root laceration. Avoid aggressive spinal twisting, replacing sudden back cracking with smooth, controlled axial decompression and gentle neural gliding exercises. By eliminating these 5 dangerous lifestyle errors, you instantly remove the primary mechanical barriers that choke off blood supply to your peripheral nerves. Combining sturdy seating, uncrossed legs, loose clothing, safe water temperature, and controlled spinal alignment creates the ultimate internal environment for complete nerve regeneration. In the next section, we will integrate this gold standard neural gliding protocol into a seamless 30-day clinical action blueprint for your daily schedule. You will learn how to structure your daily morning and evening habits to achieve maximum nerve root decompression, myelin sheath rehydration, and permanent relief from numbness. Together, we will continue replacing temporary pain remedies with surgeon-backed physical restoration protocols designed to keep your legs sensation-rich, warm, and completely pain-free. Welcome to the fifth phase, your complete 30-day clinical action blueprint to permanently relieve leg numbness, tingling, and nerve entrapment. In neuroorthopedics, short, daily sessions of targeted neural gliding are exponentially more effective than sporadic, aggressive stretches that irritate fragile nerve sheaths. Begin every single morning immediately upon waking by drinking a tall glass of fresh room temperature water to rehydrate your intervertebral discs after overnight rest. Sit upright on a sturdy wooden chair with your feet flat on the floor, locking your spine in decompressed neutral alignment. Execute 10 smooth repetitions of primary seated sciatic nerve flossing per leg, coordinating head extension with ankle dorsiflexion to slide the nerve through its sheath. Follow immediately with 10 cycles of secondary toe curling and toe spreading micro-activation per foot, driving oxygenated blood into peripheral nerve terminals. This complete neural routine takes under 6 minutes each morning, establishing an unshakable foundation of open nerve pathways and continuous blood flow for your day. Throughout your daily afternoon activities, maintain conscious posture awareness, avoiding soft slouched couches, and keeping your legs uncrossed while sitting. Set a gentle hourly reminder on your phone to stand up, take 3 deep diaphragmatic breaths, or perform 5 quick seated nerve glides to keep circulation flowing. In the afternoon, enjoy a light, anti-inflammatory meal rich in B-complex vitamins, dark leafy greens, and antioxidants to support nerve tissue repair. During your evening unwind time, perform a gentle 5-minute refresher set of neural glides before relaxing comfortably with your legs supported on a soft cushion. Prioritize 7 to 8 hours of restful sleep every night, as axonal transport and myelin sheath regeneration peak during deep sleep cycles. Within the first 7 days of adhering to this daily blueprint, you will experience a dramatic reduction in persistent toe numbness, burning, and tingling. Between days 8 and 20, as nerve sheath inflammation subsides and intraneural circulation accelerates, your foot sensitivity and floor awareness will sharpen significantly. By day 30, fully untrapped sciatic nerve trunks and rehydrated myelin sheaths will empower you to walk with steady balance and total sensory confidence. Always remember that neurological recovery is a continuous biological journey that rewards gentle, consistent daily care, rather than sudden, sporadic overexertion. Listen attentively to your body's subtle signals, honor your daily physical progress, and take deep pride in every sensation-rich, confident step you take. Let us now transition into our clinical doctor FAQ section, addressing the most critical, frequently asked questions about leg numbness and nerve health after age 60. Our first essential question addresses whether seniors with diagnosed lumbar herniated discs or sciatica can safely practice this seated neural gliding exercise. Dr. Robbert will explain why zero-impact seated neural glides actively decompress trapped spinal nerve roots without subjecting vulnerable disc fibers to dangerous compression. Our second question explores whether foot numbness caused by long-standing diabetic peripheral neuropathy can truly improve through this daily neural exercise routine. Dr. Robbert will clarify how mechanical neural gliding stimulates micro-capillary vasodilation, delivering vital oxygen and glucose to oxygen-starved diabetic nerve sheaths. Our third question tackles how to distinguish between healthy, warming neural release sensations and dangerous, sharp warning pain during your daily neural gliding routine. Dr. Robbert will share simple, actionable sensory rules to help you navigate your recovery safely without ever risking nerve irritation or inflammation. Welcome to the final phase of our Neurological Health Masterclass, where Dr. Robbert answers your remaining clinical questions and provides your complete sign-off roadmap. Our fourth Dr. FAQ question asks, can seniors suffering from spinal stenosis or restless leg syndrome safely practice this seated neural gliding exercise? Dr. Robbert explains that seated axial decompression actively opens intervertebral nerve passages, making neural gliding exceptionally effective for stenosis relief and restless leg soothing. By maintaining neutral pelvic alignment and avoiding slouched forward bending, you unpinch compressed nerve roots without triggering inflammatory spasms or nocturnal leg agitation. Our fifth FAQ question addresses whether you should perform neural gliding exercises immediately upon waking in the morning or right before going to bed. Performing your routine in the morning hydrates nerve sheaths dehydrated from overnight rest, while practicing in the evening relaxes nerve tension accumulated from daytime sitting. For optimal neurological benefits, perform 2 sets of 10 glides per leg every morning after drinking water, and execute a gentle 5-minute refresher set before sleeping. Our sixth Dr. FAQ question tackles timing and speed. Should seniors execute neural glides quickly to build momentum or hold peak positions for long periods? Dr. Robbert strongly warns against fast, jerky movements or prolonged static holds, as both can irritate inflamed nerve sheaths and trigger protective muscle tightening. Focus entirely on smooth, fluid, continuous sliding motions, taking 3 full seconds for each directional glide to allow nerve tissue to slide gently through its sheath. Our seventh FAQ question asks how quickly seniors can expect to observe visible reductions in foot numbness, burning sensations, and tingling discomfort. Most aging adults report immediate warming sensations and noticeable relief from acute tingling within 48 hours of beginning daily neural gliding and toe micropumping. Significant improvements in foot floor sensitivity, standing balance stability, and sensory clarity typically materialize between days 14 and 21 of consistent practice. By day 30, your peripheral nervous system locks in these restored conduction pathways, giving you steady balance, warm sensation-rich feet, and renewed mobility confidence. As we conclude this clinical neurological guide, Dr. Robbert wants to leave you with a message of biological hope, personal empowerment, and sensory resilience. Never accept the harmful myth that dead numb feet, burning toes, cold dead legs, or unsteady wobbly balance are unavoidable consequences of growing older. Your peripheral nerves, spinal cord nerve roots, micro-capillaries, and sensory mechanoreceptors retain an extraordinary biological capacity to adapt, rehydrate, and resensitize at any age. By replacing temporary nerve-numbing creams with this surgeon-backed simple neural gliding exercise, you systematically resolve the root cause of nerve entrapment right from home. Commit just 5 peaceful minutes every morning to expanding your spine, tilting your head, flexing your ankle, and pumping oxygenated blood into your foot nerves. Listen attentively to your body's subtle signals, celebrate your daily sensory progress, and take immense pride in every confident, sensation-rich step you take. Share these life-changing neurological secrets with your family, friends, and community to inspire everyone around you to live active, numbness-free lives. You now possess the complete clinical biomechanics, the gold standard neural exercise, the daily 30-day action blueprint, and expert doctor guidance required to restore your nerves. Take charge of your neurological health today. Decompress your lumbar spine, slide your sciatic nerve, awaken your foot sensors, and reclaim the vibrant life you deserve. This is Dr. Robbert, wishing you radiant physical health, resilient nerve pathways, warm, sensitive feet, and a steady, confident stride every single day of your life.